Well, every time Catherine's here, it's a special day, so I'm excited. Thanks so much for joining us. So we have a lot of small things today for me to talk about. We were also just finished, Janet Lee and I were just finished doing a fascinating podcast on this fatty acid molecule called C15. So I'll talk a little bit about that. You know the drill. Drop the questions in the chat. It helps to generate questions as early as possible so that Catherine has appropriate amount of time. I do want to again remind everybody that I'm going to leave a couple of minutes earlier, probably 10 minutes, because we have our mental health and trauma open house starting at 3. I have posted links. I will repost them in a little bit again. If you're coming, don't rush, finish up here. We'll wait for everybody at another link. It's not the same link as this one. It's a different one. We will be recording that and we'll be posting it on YouTube channel, just like all other open houses. So, but if you come, you can ask your questions. Okay, so let's jump right in. Some COVID news first. New data on the vaccine effectiveness of being at around 50%. This was just released. I'm gonna put the link to the stat news if any of you would like to read that. So my reflections, I did not review the study itself. It will be on my to-do list in upcoming weeks. But I think 54% protection against symptomatic infection is sort of probably expected ballpark. It's about where the flu protection usually sits earlier in the season at around half, flip of a coin, basically. It's definitely worse than it used to be. I think the earlier vaccines were protecting against severe illness a lot better. They were still protecting against asymptomatic disease at some slightly higher number, but I think we should expect that this kind of a trend to continue. It is a good news in a way, though, that the new variant, the vaccine's still working again. So I take that all as a positive, not as negative. So, because, obviously glass half full. So those of you pessimists in the room going to say 50% is not good, I would say, yeah, no, 50% is good, but I am an optimist. So that's the reflection on the vaccine. Now, I do find one little bit of information a little puzzling and very concerning. They did something which is always supposed to be done. So they looked at 60-day efficacy, and then they looked past 60 days to 120-day efficacy. And it's 60 days about 58%. And then, but by the time it got into 120, it got 49%. So it looks like potentially what's changing is the drop in effectiveness from vaccines is a lot faster than it used to be. I have a pretty famous YouTube video on this topic that I posted, the Lancet study, that generated a lot of very, some people yelling at me saying, how could you say this? You're a doctor, you're saying vaccine's not effective. And some people are saying, oh, this is the best video ever. So you be the judge of it. I'll post it out there. It's kind of funny that basically the point of that was natural immunity was lasting longer. That's all I was trying to say. I wasn't trying to be contradictory or anything. But the point that we already have accumulated enough data to look back and say that definitely whether it's a natural immunity or vaccine, the waning effect is real. Natural immunity lasts longer. Again, it's all expected. There's nothing new here. If you look at flu, it's exactly the same. So how you should integrate that new data into your care? I'm not sure it's really changing anything. I'm not going to change any of my recs. I'm not going to recommend vaccinations more than once a year, at least until something changes, unless somebody is very high risk, which again, somebody who's quite immune compromised. So, so that's news number one. News number two, a lot of people getting sick, right? So I would say on average, I'm getting a patient a day contacting us, me personally, with a COVID. I mean, for the whole clinic, it's way bigger, bigger numbers. And I think with that, one topic that comes up just almost every day, how long should I be in isolation? What's out there? The CDC is not changing their recs. They're saying you have to be 10 days from the first day symptoms appear until you clear the illness at, it doesn't matter how quickly you clear, for 10 days, you should still be in isolation. Interesting, multiple states in California just joined refusing to acknowledge CDC's recs, and they basically saying after 5 days, if you have no symptoms, you're okay to loosen the isolation, although they ask that you wear a mask in public. not in public, like openly outside, but when you're in an enclosed space with somebody else, that you should wear a mask. And if you still have symptoms, obviously you continue to isolate. So they're kind of breaking away from CDC recs. I am no longer recommending people trying to do testing to prove that they're negative. Unfortunately, GN1 has a lot of testing problems. We're seeing patients getting 3, 4, 5 tests and only then getting positive. So if you quickly revert to negative test, I wouldn't take that as a sign that you're completely non-infectious. I think that for whatever reason, and it's not really clear because the tests pick up the GN1 no problem. So I think it has to do more with the fact that the virus is more virulent. And because of that, the amount of particles is smaller. So it's harder for tests to pick it up. It's not that it's not there or that the test performs poorly. It's simply you need to have enough material to test to turn positive. I don't know if that means that the industry will try to develop newer technology or some kind of an updated test that would have a better pickup rate. But until then, just have a lot of tests at home. Government had restarted the free testing. So unfortunately, they only send 2 instead of 4 now. But I believe that you can order them very frequently, in contrast to how it used to be. So my suggestion is just, actually, I don't know if anybody can check that up. Check it out. You see how frequently you can order, but I would use that and I would just keep getting free tests. You can always buy them, right? You can just walk into the CVS and buy whatever the tests you need to buy. But if you can get free tests, it's always nice. So that's COVID updates. Any questions about anything COVID related right at this point before I talk about some other things? Because I don't see anything in the chat. Okay.
Is there a link to the free testing information or the site?
Sure. I think we did it last time. Let me try. It was really quick that I found the link. I think it's just this.
Looks like it's covid.gov.
Yeah, no, I'm putting link that still says 4 tests, but I just ordered it 2 weeks ago and I got 2. And I've heard from somebody else the same thing, even though over here they say if 4 additional tests. So I'm not sure what that means, 4 additional tests. Here they say you can order up to 8. Again, I don't know at what time frame. So just keep trying. That's all I can say. Good question. All right. Anything else? Otherwise, I will talk about other things. Okay. So because of where we are in terms of numbers, right? So there's still, it's a big wave coming through. I was thinking to talk a little bit about immune optimization and sort of the key things you can do, not necessarily in the sense of, okay, take all the supplements. That's not what I want to talk about. I just want to talk about like basic key pieces of how you can upregulate your immune system. We talked about all of this. I'm not going to say anything new to anybody, but it's more of a recap and also an attempt to engage all of you into a little bit of a discussion, because I think it would be good to talk about what works for whom. What are specific things that tend to work for you more. So I'll start. Definitely cold training has always worked for me as a kind of an anti-cold remedy. I think it's one of the most profound ways you can upregulate your immune system within a few weeks. There's a lot of data saying if you start some kind of a cold shower, cold training, that you can boost immunity pretty quickly. It takes a couple of weeks. Yes, it's not the most pleasant thing in the world. And frankly, I've been doing it for years and it's not any better. Like it's years later, it still sucks. But at the same time, like I feel you pay for it for like 30, 60, up to 2 or 3 minutes. But then when you're done, it feels amazing, right? You feel like you're a new person afterwards. So there's that. I always joke, I hate yoga, but I do it because after that, I feel so much better. So in contrast to Tai Chi, I love Tai Chi, I do it, but I don't feel a whole lot better after. So I don't know. I know B is here, so maybe she has some magic that she can tell us about how to feel good after Tai Chi. I feel same way. Yoga is a bit more physical for me when I do more. So, okay, so exercise, whether, especially exercise bound or combined with a mindfulness. So that's why I brought up yoga and Tai Chi, I think is a very critical component of boosting immune system. Tai Chi has a lot more data on boosting immune system. Those of you who haven't seen my podcast with Dr. Ekstrom on the benefits of Tai Chi, I highly recommend it. She's amazing. She has a great book. I think it's called, forgot what it's called, a couple of weeks. I just finished listening to it and I really forgot the name. Shame on me, but I'll put the link to it the moment I find it. So she talked about effectiveness of Tai Chi first on bones, on falls, but then they actually studied it for all kinds of things. And most recently, they studied it for Alzheimer's disease. They didn't study it for immune boosting, but there's been multiple studies done looking into Tai Chi for immune boosting. Quite effective. They've done studies where they would have people do Tai Chi, and then they would give them a vaccine. And the Tai Chi dramatically boosted efficacy of the vaccine, upwards of like two digits, 20, 30% boost on top of what you would expect without it, or just regular movement. Lots of explanations, sort of theories why that could be happening, but it doesn't matter, right? Who cares if it works? Okay, so question, how long to do the cold training? So if you're doing cold shower, you know, if you novice, I recommend doing back and forth. So hot and cold. So you could do maybe 30 seconds cold and hot and end on cold. If you're used to cold, if you're going into water, like right now, let's say you have a natural source of water and you're going to go into the, let's say a pond or an ocean, the water will be around 40 degrees, maybe just under, just over. Usually when I do that, it's like 30 to 60 seconds. I don't sit there for many minutes. The data seems to be concentrating around 3-minute period, but up to the knees. So it's a kind of a lesser exposure in terms of surface. Wim Hof, they've done studies using their method, and they don't necessarily know what the exact best timing is. But generally, it's recommended that you push a little bit closer to at least a minute. If you can get to 2 or 3 minutes, that's probably the ideal goal. If you're doing a shower, it's a little difficult to kind of get the whole body into the shower with cold water. So you're going to rotate, you're going to kind of move the different body parts. It's a little bit easier. Although people who go into the natural pools of water say they hate shower because it's actually cooler. When you get into the, let's say, lake or even an ocean, you form a little bit of a layer between you and a water, so to speak, that you warm up a layer. So it's actually not as cold. It sounds hard to understand until you actually do it. So shower is a bit harder because the water is constantly running through. So it actually takes away more heat from your body than walking into the body of water, unless, of course, water is much warmer. Okay, so that's exercise, cold training, adequate sleep, big piece. I would say, especially in the winter, notice how we naturally gravitate towards sleeping more in the darker periods of the year. Guess what? There is an important point in that, because in that period of time, our immune system is a little bit deactivated, if you will, during the winter. Not just because vitamin D is lower, but other reasons too, because circadian rhythm, we are following circadian rhythm, and it does trigger particular immune balancing acts. And so sleeping a little longer in the winter, it's actually a natural body desire. My suggestion is follow the natural rhythm. If you feel like sleeping a bit more, okay, do that. If you know you have a problem sleeping, try to fix it. I think that's a very important component. And with the diet, I would say one of the biggest things that can rapidly worsen the immune function is a significant shift in the simple carbs. So if you have a sweet tooth, if you take a lot of carbs, then it is a potential negative impact. So lymphocytes, particular activation of lymphocytes, can be not as effective when somebody is on a very high simple carbohydrate diet. Other than that, of course, food-based antioxidants from plants are probably the second most critical aspect of the diet. So that's that. I don't want to go into supplements. We talked about them a lot, but you know the usuals. I'm just going to list them real quick. The C, the zinc, adequate intake of those. Very important to make sure you have some balanced fatty acids. We're going to come back to fatty acids in a second because I'm going to introduce something brand new. I'm just holding on until the last before I want to spend a couple of minutes on that topic. So fatty acids balance, if you don't know your own balance, let's say you're wondering, do know that it can be tested. It is actually relatively easy to test fatty acids nowadays. It's a standard. Even LabCorp, I think, beginning to do that now. Otherwise, critical to make sure you have adequate amount of protein. So that's one component we haven't, I think, talked enough. People who deficient in amino acids or don't eat enough protein are gonna have a very quickly dysregulated immune system. Why? Well, guess what? If you don't eat enough protein, it means you're not gonna have enough amino acids to make proteins required for the protection. All the immune cells require protein production constantly. The antibodies are what? Proteins. So you have to make enough of all of this continuously. And so if your diet is protein deficient, you're going to start not having an optimal balance or optimal function there. So with that, in a standard way, at least a gram per kilogram of protein. If you're going through, let's say you did get COVID, you're definitely bumping it up. You should go up as much as 1.5 gram per kilogram of protein. That seems to be the better level. So that, by the way, if you think about this for a second, if you're 50 kilos, that means you have to be eating at least 75 grams of protein. One egg is 7 grams. Now, I'm not telling you to eat 10 eggs a day. That's not what I'm trying to say. But, you know, it's balanced, right? So you're going to have different sources of that protein. If you can't get to it, I don't have any problem with people supplementing, taking extra protein powder or getting amino acids in a capsule or a powder form. I have no problem with that. Okay, so next, quite an also important point, again, before we go to C15, the issue of knowing your own particular deficiencies. This is quite critical. If you have not had your vitamin D tested, you know, and yes, I know there's a lot of critique. Oh, taking vitamin D doesn't seem to do anything. We used to. Yeah, but that's not what we're discussing here. You need to understand whether or not you may be deficient, right? So if you're deficient in particular nutrient, make sure you fix it. The D, E can be tested. Vitamin A can be tested. C can be tested. All the nutrients can be tested. When to test, it gets a little more complicated. You would need to, if you're not my patient, you know, the good questions to ask are the follows. If I have a particular problem, can that problem be associated with a deficiency? If the answer is yes, you probably want to test that. Patricia has a question, so I'm going to pause and have her unmute herself and speak.
Hi, yes. You know, I heard that protein powders, let's say they have 25 grams of protein. The nutritionist once told me that even though it has 25 grams of protein, you're actually only absorbing half of that. Does that make any sense to you? Or
yeah, it does. It's correct. It's 100% correct, but it's not really relevant to this conversation because that 75 grams that I'm saying, that's the 75 grams of protein you should be eating. It doesn't mean you get that 75 grams. It's 100% accurate. We get about a half, but so there's an adjustment. It's actually an important adjustment because if you look at some literature, people often don't realize that some of the nutritional texts and nutritional recommendations are based on what our bodies need. So with that, we don't need 75 grams if you're 50 kilos. You need about half to 2/3 of that. But you have to eat 75 to get to that point. So there's a little bit of that confusion, and sometimes people don't even realize that. It's actually a critical question points. Thanks, Patricia, for bringing this up. It's true for every single nutrient. We only absorb some percent of whatever we eat. And so, but each nutrient has its own absorption coefficient. For example, sorry, I'm going to ask, once a teacher, always a teacher. What nutrient notoriously dramatically drops absorption with aging? You all know the answer. I'm just curious who gets there first. You can just type or unmute. I'll give 30 seconds. You all know the answer. It probably has the largest drop in absorption over the years when people start getting older. No, calcium absorbs pretty steady. You need some cofactors to absorb steady calcium, like vitamin D, but it doesn't really change with aging much. It has some drop, but not as much. Want a hint? It's one of the vitamins. That's it. No other hints, otherwise it's too easy. That's it. Thanks, CJ. So it's B12. B12 can have up to 70-80% drop in absorption through the lifespan because intrinsic factor and acid production decrease steadily past certain age. So B12 is notoriously known to drop absorption quite a bit. So, it's easy to compensate. You just take a lot more, right? But it's true for every nutrient. Okay. I think, unless there are other questions about this particular topic, so sort of keeping your immune system steady, keeping it active. Remember, all in all, the balance and the strength of our immune system, in my opinion, trumps everything. It trumps vaccinations, it trumps medications, it trumps everything. Why? If you have a very weak and dysregulated immune system relying on vaccines and drugs, sure, that's what we do. But the first step, in my opinion, in my book, health-wise, should be geared towards getting your immune system as optimized as you can. So perfect time to talk about this in the winter. Okay. C15, I'm going to type that, C15. So I have never heard of this until Dr. Frame brought this up some weeks ago. It's one of the fatty acids. It's actually in this saturated type of saturated fat. We used to be taught that all saturated fat is bad. Turns out that it's complete bogus. So there's several forms of saturated fats that are critically essential. Turns out that C15 is one of the strongest linked fatty acids to all kinds of diseases: diabetes, liver disease, potentially Alzheimer's, Parkinson. I'm not going to spoil all the alert because we have just finished the podcast with the person who discovered Stephanie Watson. There's two names in her last name, Watson, I think, and her husband Eric. They discovered this working on dolphins. A pretty fascinating story. They were studying geriatric dolphins. Apparently, dolphins in captivity live a lot longer, 20-30% longer, and so they had an opportunity to study this, and they did this genetic analysis, not genetic analysis. They basically studied microbiome. They studied which nutritional factors were associated with healthy old dolphin versus not healthy old dolphin. And they found this one of the C15, this essential saturated fat in our body, that level seemed to be strongly associated. And then they unraveled research after, and it's pretty fascinating. So they came up with a product that's actually now available as a supplement. I'm pretty sure you're going to hear a lot in upcoming months and years about this topic, particularly since it seems like C15 is regulating our own endogenous cannabinoid system. And it seems like that the biggest thing is that C15 is potentially linked, when it's low, to a significant downregulation of endocannabinoid system. The link here appears to be a pretty unique. We did know that fats are associated with the cannabinoid system, and there are multiple different fats that are associated. This one seems to have a unique feature that is associated with both receptors, CB1 and CB2. So the particular type of endocannabinoid, which is PCM, and I will have to Google it to figure out exactly what it stands for. It's some kind of a modified C15 that our body modifies. It's the only molecule that's so far known that has a profound activation of both CB1 and CB2 in our body. Otherwise, most of the endocannabinoid trigger one receptor. Some of them trigger two, but in different ways. This one seems to be quite unique. Importance of all of this, well, C15 we get primarily from dairy. We don't get it from a lot of foods, and we get it from saturated dairy, so the dairy that has a lot of fat. So guess what? The whole public of US has now been recommended to eat fat-free milk for a long time. And we're beginning to see a dramatic increase in C15 deficiency in the country. It's also turned out that if you're my patient and you had the test NutriVal, I will go back and look at it because we actually been assessing C15 level now for a decade, and I had no idea. So pretty fascinating. Janet, thanks so much for putting it out there. So please stay tuned. I'm going to end right here because, again, I don't want to spoil you listening to the founder and of this whole fascinating research in the company. She's answered all the questions much better than I have, and hopefully we'll have her back, and also potentially we're going to do some research here. So with that, it's right 2:30, perfect timing. Again, a reminder, if you're going to come to the CIM open house on the trauma and mental health right after this, I'm going to repost the link in a second. I'm going to leave a little bit earlier, so Janet's going to wrap up with Catherine without me. And without further ado, thank you, Catherine, for being here. Oh, thanks, Janet, for spotlighting her, and thank you.
Thank you, Dr. Kogan. That was really fascinating. I'm going to have to look into C15. And thank you, everyone, for being here. Actually, I invite you all, let's just take a moment just to kind of take a pause, taking in all the information that was shared. Maybe taking a moment just to integrate it. And whenever you're ready, I invite you to come into a comfortable, seated, reclined, or laying down position. You can feel free to turn your camera off or leave it on, getting any supports that you might need as we get as comfortable as possible. When your body feels ready, I invite you to take a deep breath in through your nose and exhale, sigh out through your mouth. Perhaps notice any gentle shifts in your body just from taking a deep breath in and exhaling it out. Once again, when you're ready, deeply breathe in through your nose, feeling your torso fill up with breath, and exhale, sigh it out, release. And once more, deep breath in through the nose. Exhale, let it go. And now allow your breath to return to a gentler or natural or normal pace. Perhaps your breath feels like it's moving a little bit deeper on its own. And over the next couple of minutes, I invite you to just observe your breath, noticing what it feels like to breathe in and breathe out, without forcing anything at all. Observing your breath as you would something within your viewpoint, perhaps flowers in a garden, plants in your home, or maybe even a loved one. Using that to turn inward and just notice your breath. Continuing to breathe, I invite you to draw your attention and awareness to your belly area. And if it feels comfortable for you, I invite you to breathe deeply into the belly. As you breathe in, feeling the belly, the sides of the belly, and even at the back side of the belly expand as you take in breath, almost as if you were filling up a glass with water, and exhale, feeling that opposite sensation as we're pushing the breath out of the belly. Let's repeat this a few more times, breathing at your own pace. Again, drawing that attention and awareness to the belly, if that feels comfortable for you. On your next round of breath, I invite you to draw your attention to your lungs and notice what it feels like to breathe deeply in and out from that lung space area. Notice, again, if we can breathe into the whole area of the lungs, the front, the sides, and the back of the lungs. Taking a couple more breaths in and out from this area. And now bringing your attention to the upper chest area. If it's helpful for you, you can even place one hand on either side and notice what it feels like to breathe into this space, this upper chest. The breath may feel a little more shallow compared to the belly and the lungs. Taking one more breath in here. And if it feels comfortable for you, we'll put it all together. So breathing in to the belly, the lungs, and the upper chest. Exhaling out upper chest, lungs, and belly. Inhale, belly, lungs, upper chest. Exhale out upper chest, lungs, belly. I invite you to repeat this a few more times, breathing at your own pace. This 3-part breathing practice really helps us to breathe into the entirety of our torso. Oftentimes, we usually only breathe kind of in this upper part of our chest. And breathing in and out in the entirety of the torso really help us not only breathe more deeply, take in more oxygen, but also can help to calm us and ground us. Something we can do at any point in the day. No one even has to know.
His life, saving hers.
Take 3 more rounds of breath here in this 3-part breathing. Gently releasing the 3-part breath. Once again, allowing your natural state of breathing to come in. Observing the breath once again. Noticing if the quality or what the quality is like and what it feels like to breathe here and now. Continuing to breathe, we'll now move into a gentle guided body scan. If you need to adjust the position that you're sitting or reclined in, you're invited to do so now. And during this body scan, you do not have to make any movements or do anything. Just keep breathing. And as I call out different parts and areas of the body, I invite you to bring awareness to that part of the body. Again, without movement or the need to do anything at all. Drawing your attention first to your right hand thumb, index finger, middle finger, ring finger, pinky, right forearm, elbow, upper arm, shoulder, entire right hand, arm, and shoulder. Entire right hand, arm, and shoulder. Left hand thumb, index finger, middle finger, ring finger, pinky, left forearm, elbow, upper arm, shoulder. Entire left hand, arm, shoulder. Entire left hand, arm, shoulder. Neck, back of the neck, back of the head, crown of the head, forehead, right eyebrow, left eyebrow, right eye, left eye, right ear, right cheek, the nose, left cheek, left ear, the mouth, lips, chin, whole face and head, whole face and head, throat center, upper chest, heart center, back of the heart, the lungs, the belly, navel center, the sits bones, the right hip, right thigh, knee, shin, calf, right heel, the whole foot, entire right leg, hip and foot, entire right leg, hip and foot. Left hip, thigh, knee, shin, calf, left heel, left foot. Entire left leg, hip, and foot. Entire left leg, hip, and foot. Notice the entire front side of the body. Entire front side of the body. Entire back side of the body. Entire back side of the body. Top half of the body. Top half of the body. Bottom half of the body. Bottom half of the body. Notice right side of the body. Entire right side of the body. Left side of the body. Entire left side of the body. Become aware of whole body. Whole body. Notice whole body all at once. Breathe into the entirety of your body. We will stay here for 1 minute. Keep breathing into your awareness. And as you're ready, I invite you to deepen your breath here, allowing your awareness to soften and just be. With each deep breath, allow your body to relax a little more into the grounding practice of awareness that we just completed. Allow yourself to rest here for just a few more moments. Nothing to do, nowhere to go. Just breathe. Whenever you are ready, you're invited to begin to make any small, gentle movements in your fingers, in your toes, in your wrist and ankles, or in any other part of the body that is calling for gentle movement. Perhaps stretching the arms out or overhead, maybe drawing the head side to side. Anything you need right now. As we slowly begin to bring our awareness back into our space on the surface that we're on. Slowly beginning to open our eyes when you're ready. As we come back to our virtual space together. I hope that this has been a nice grounding practice for you today. Taking some moments to breathe, to bring awareness to our bodies. This is something you can do at any point on any day. Thank you so much for joining me.